This is the liver, and we have 4 lobes to the liver. Now this is the anterior view, and in anatomical position, this is the right side where my finger is. Across from this ridge of connective tissue we have here, we have the left lobe. So the left and right lobe are separated by a ligament of connective tissue, sometimes called the falciform ligament, as we find in the textbook, or the round ligament, as we see in our lab packet. And this goes all the way around. So in some areas it will be white, in some areas there's no color designation for it, but you can follow it all the way around. Now turning to a posterior view of our liver. Again, we have the left lobe, so now I'm holding the left lobe. Across that we have the right lobe, and in between here we have the inferior vena cava. The inferior vena cava and this round ligament create a separation for the caudate lobe, which is the third lobe to talk about here. Farther down, we have the gallbladder, which is a completely different organ, and the gallbladder and that round ligament separate the fourth lobe, the quadrate lobe. I remember caudate versus quadrate in that C is before Q in the alphabet, and C is superior to the quadrate on the actual liver if you're holding it in anatomical position. Now getting into some of these vessels that we have here. In red we have the hepatic artery. In purple we have the hepatic portal veins. So remember, this is that funky supply where we're getting blood from the intestines and delivering it to the liver so it can be filtered. Now we have a few ducts. This is the cystic duct here coming from the gallbladder, and these two little branches here form the hepatic ducts. The cystic and hepatic ducts come together to form the common bile duct, which is going to go to the small intestines. Now I've made a little diagram here. Alright. Common bile duct, cystic duct draining the gallbladder, hepatic ducts are draining bile from the liver. Now in draining, that material will continue to go down the common bile duct. And if it starts backing up because that's not open, then it will back up into the cystic duct and into the actual gallbladder. So we need to know, and all of this is in green on this model. So you've got, well, I'll do it one more time, hepatic ducts here, cystic duct, and common bile duct up here. Thank you.